Hi you guys, welcome back to the channel. For those of you who don't know me and this is your first time here, my name is Netta like feta. And for those of you who do know me, you probably know me from Operation Surgeon on Instagram. So today we are going to be trying to hit a couple topics. Actually no, we're just going to stick to one, why not? And it's going to be how to get your foot into volunteer and basically how to get yourself into the hospital to gain clinical experience. And everybody has a different way of getting into it, whether it be someone you know and they're awesome enough to pull you into the system, or if it's you actually going out and doing the legwork yourself. So personally, let me give you a quick background on how I started volunteering in a hospital. I was actually in a bio course with a couple people, and one of them was this girl, and she worked as an inpatient pharmacy volunteer. And back then I was on the track for becoming, or planned on being, a pharmacy major, and I was like, why don't I get my foot into the sometimes it sucks, but sometimes you have to see other people do it to realize that that's something that you should probably be doing too. And I was fortunate enough to be pulled in by her. She recommended I come with her to the hospital one day and meet the volunteer coordinator. Now, it's good to know what these people's titles are and why are they like that. Coordinators are the ones who are hiring, and they are the ones that are onboarding you. They're the ones who are essentially, telling you to get your TB shots, your flu shots. For some programs, you might need a letter of recommendation. For this one, I knew I needed about 3 people to vouch for me that I was either a student that was, a good student, or if, just someone that they could reference back to. Now, I began volunteering as an inpatient pharmacy volunteer, and that entailed, just being in the inpatient pharmacy in a community hospital, packaging things, cleaning up the area. You're basically doing a bunch of stuff to free up the time of the pharmacy techs, the actual pharmacist. You're making their life easier as a volunteer. You're not actually going to be able to do things. I think that's kind of a common misconception. Now, if you do have certain certifications, like you have an EMT-B, or if you are a certified clinical technician or medical assistant, you could absolutely volunteer those skills because you are certified. Now, I was not certified in any of those things, so I tried to basically get my hands on anything I could that was within hospital, grounds. And that's the importance of volunteering, is that I realized pharmacy wasn't for me. From there, I actually was able to work very closely with the volunteer coordinator, and she was kind enough to let me bounce around the hospital and really experience the hospital and all of its glory and all of its departments, essentially. So she was definitely on the same sine wave of understanding that I was a future medical student. And most of the people there are either the elderly and they're going there to give back to the community, or they're actually students. A lot of them are high school students. Sometimes you feel like you're the oldest person there of, the younger people, but that's not necessarily the case, because a lot of these people are, pre-health majors. So I was able to work as a retail / admin position as a volunteer in the latch clinic. So that was the lactation room is what they called it. And I worked very closely with a couple lactation consultants. And these are registered nurses who have basically done additional credits into becoming specialized in breastfeeding, on how a mother latches a baby. How a latch is basically how the baby holds onto the mother's breasts when they are beginning to eat. And so I got to see a lot of cool things. I saw moms who were so incredibly uncomfortable with, they had pain, they were engorged, or they had, their babies, they're frustrated. They don't know how to get their baby to eat, and they're getting frustrated because their baby's losing weight. You see a very interesting side of medicine in every department you go into. And the experience that I had as a volunteer in the lactation consultant room was completely different than the experience I had when I moved to the emergency department. So it's important to be able to see what departments are available. And so I worked very closely with them for a while until I was kind of like, I want to see more people. I want to see different populations. And you know what? As a volunteer, you have the luxury of doing that, especially within a hospital system like that I worked for especially. And because I was older too, I think they gave me that. And not even because I was older, it was just the fact that I was always so curious. So my biggest suggestion is, if you do get your foot into one of these positions, don't play around with it. Make sure that they understand that you're very passionate about, you know, giving back to your community and, you know, just learning. A lot of the times learning is the biggest thing here. I mean, you're going there to learn about the hospital. And if you don't get your foot into the hospital, you'll never really learn about it. And so I basically was like, look, I love working here, but I want to see another part of the hospital. She's like, okay, cool. Well, do you want to train for the emergency department? And I was like, oh my goodness, yes, I would love to. Now, this wasn't a level 1 trauma, so you were not seeing the same things you'd be seeing at a level 1 trauma. The sister hospital that was connected to it that I ended up later working at was a level 1 trauma, but this one was more so a community hospital where their cases were not as extreme, but pretty extreme for me, considering I'd never seen anything like what I was able to see when I was volunteering there. And let me tell you some of the things I did when I was volunteering at these hospitals. It was restocking supplies, folding towels, turning rooms, sometimes just giving a patient a cup of water. And like, you get to talk to these patients. Sometimes they're, you know, they've been there and they're frustrated. I was passing out tissue boxes to people who were crying. And there's people who go in there, they're terrified, and there's so much hustle and bustle that I can't even count the number of times where I would literally sit with a patient's family member who was like the only person there, and I'd be like, it's okay, you know, we'll get through this, just, you know, you'll just breathe through your nose so we don't have to call a code on you. So you are a very integral part in the hospital system, and I can't even tell you how important volunteers are to hospital systems, especially those that are very in locations that cater to those who are socioeconomically disadvantaged. The health disparities that you get to witness that are unfortunate that they're happening in this day and age, you get to see those things. And you get to learn from them. You get to really open your eyes to a different kind of cultural, I guess, a different cultural base. And you appreciate that. You appreciate your position a lot more too. What else? So I got to basically bounce around all over the hospital. I got to see their medical surgical units on a smaller scale compared to what I ended up working on. And it was awesome. And from that hospital, I was able to coordinate and essentially just bounce into the next hospital system as an employee. And this is the question I kind of get a lot, and that's, how do you become an employee? And we'll get to that later. So I just want to harp a little bit more on the volunteering though, and that's, how do you get into it if you don't have someone to pull you in? And that is up to you. No one can do the legwork for you. That's you reaching out, being proactive. Find out who the volunteer coordinators are for hospitals, local clinics. You can literally Google is your best friend. By not doing the research, you're really limiting yourself to the options that people give you if they do give you an option. Think of certain keywords that you'd probably search. Volunteer opportunities in X state that you live in. Clinic opportunities. Or you could, you know, essentially, if you don't have a skill that you want to maybe volunteer in, how about searching to see if they have a free or discounted class for students, or if they have something that could make you a little bit more hands-on, which is what you might want. Now, I would highly recommend working with populations that you're not comfortable with, because those populations are the ones that you're going to be working with a lot. sometimes it's sad and overwhelming to, you know, work with people who are just like completely just not, it's not fair. You're just gonna want to help them though. I mean, being a volunteer, just got, you know, peppermint tea. Anyway, so yeah, you want to get those, you want to help those populations. So why not look for them specifically? So besides volunteering at a hospital, you can definitely work as a volunteer elsewhere. It doesn't necessarily have to be a hospital. It could be a local soup kitchen. It could be a shelter. It could be anything really. By volunteering your time, you are really getting to know people and how to communicate with them, which is a big skill that I feel like isn't harped on as much, because doctors are all brains, right? You gotta have the emotional intelligence too. So I think volunteering is great, and you know, make sure you keep those connections that you've made at those non-medical volunteer positions. Contact those people and say, hey, do you know of any medical positions that I could help volunteer at? Or do you know if I could maybe get certified with the Red Cross to do certain types of, you know, help? Like, there's so many things that come out during times of crises, especially like, let's talk about Hurricane Irma and Hurricane Harvey. All those hurricanes, you saw an outpouring of different kinds of certifications and different kinds of resources that come out, because when times like that come, everyone gets all hands on deck, but they just want to make sure that you have that proper training. So I would reach out to those organizations and say, hey, is there any way I could train for this? I'm a student. I'd love to get involved. And that's really important that you word that in an email very professionally. Or if you're calling them, make sure it's professional. You don't want to come off as aloof, or you don't want to come off as sloppy. At the end of the day, you are a professional, and because you're working for free, don't think you're not a professional. You are 100% a professional, and you need to actually behave like a professional when you go into these situations. So when you go to meet that volunteer coordinator, treat it like an interview. I would wear a suit, or I would wear some kind of professional attire. Take your resume, possibly a list of references, maybe a letter of recommendation, and treat it like something that's going to last you a lifetime, because these volunteer coordinators and these managers are people who can eventually write you letters of recommendation. And I think that's a good way to work, especially if you don't burn bridges. Do not do that. That's not a good idea. Definitely work towards keeping and maintaining those connections, because you never know when you'll come back from medical school and you want to work out and volunteer in a certain region or, you know, department, and you have someone who can vouch for you and say, this person was an excellent volunteer. I highly recommend that they work in your department. And you know, the magnitude of that depends on how great you are as a volunteer and how great that person is as a coordinator. Does that make any sense? So yeah, that's the volunteering segment. It's essentially in your hands. Contact your universities. Maybe if you don't have a pre-health organization, contact just your university. All the departments have something. Ask and see if they have something that's available to you to get your foot in. Next up is, what are we going to talk about next? Employment. So I get this question a lot, and it's hard to answer because you're working for the experience and not necessarily for the life savings. It sucks because a lot of the times the positions that you're going to be working at the hospital for are, that was not good English, oh my goodness. The positions that you'll be working at the hospital, whoa, what is going on? I can't even talk right now. The positions don't pay well. I just want to say that. That's all I wanted to say. They don't pay well. They're hard, they're difficult, they're exhausting, but they're so important. I can't even express how vital working on a hospital nursing unit was for me. I think I'd seen more medicine than I'd ever seen in my entire life. Now, not everyone ends up at a hospital. I think when I was the last time I was in a hospital was when I was a kid, and I was probably sick and I don't even remember it. So my concept of a hospital was very minimal. Besides, we're volunteering at a hospital. Volunteering is very different than employment. As a volunteer, you have access to certain things and they're very limited. You are not a paid employee. The liabilities are totally different than being an employee. As an employee, you have access to a lot more things and locations and information. And it's the information that I thought was the most valuable when I was working there. Because let me tell you what I did. I was the unit secretary, and my unit was actually transforming from an intermediary care unit to a medical surgical unit, and then eventually transformed into a surgical unit. And in that time frame, it was a very turbulent, it was a very unstable unit in the sense that it was brand new and very understaffed. So when I became a unit secretary on that unit, it was kind of like you became the conductor. You learned the ins and the outs of the hospital because you had to, for the sake of this floor not drowning. And I didn't give myself enough credit for that position because I was like, I'm just a secretary. And then I realized, no, I just ran into a room and called a code on a patient that was seizing. Don't ever just yourself, which is kind of like my biggest message in terms of employment. Don't think a secretary at a hospital is the same as a secretary at a regular corporate job. It's nothing the same. It's not the same at all. You are actually interacting with patients. You are, at least I was in and out of patients' rooms. We had a very heavy unit. Our acuity was it was incredibly high. And for those of you who don't know, acuity-based staffing is a thing that goes on nursing units that's essentially ranking the patient on how difficult they are, and not in the sense of difficulty as a person, like they have behavioral issues, but in terms of how much care they need. And I guess their Braden scores are taken, and Braden scores are the bed sores. Do they need to be flipped every 2 hours? Do they need a high level of wound care? Are they on blood thinners and they're considered a fall risk? Are they confused? There's so many factors that go into acuity, but unfortunately our floor was severely understaffed, so I had to learn all of that stuff. So it was really interesting because you got to see a lot. I can't even imagine the knowledge I wouldn't have today if I didn't work there. There's so many things I learned working there, and so many temperaments. I worked with so many different kinds of doctors that I felt very comfortable communicating with them. And the thing is, with this employment, you're not getting paid at all. But if you use this experience and this opportunity, whether it be a patient care technician, and sometimes they do provide you the training for that, at my hospital they did, or if you are a phlebotomist, what matters is how you use that entire situation. And my favorite thing in the world is, it's this quote, what is it? I'll figure it out. What is it? The reward for good work is more work. And that's not a bad thing, because when I was doing certain things, I wasn't rewarded for them essentially, but I did gain trust and I did gain more responsibility because of that trust. The nurses trusted me to write their schedules for them. And I don't mean the schedules of when they come to work. they meant the acuity-based staffing of how many patients, depending on what medications, what their scores are. I think it's the Johns Hopkins unit scale for, oh my gosh, there's so many things. But I would take that into consideration when I would make the nurses' schedules for when they'd come to work. Which patients were they getting? Which patients were they not getting? What patients on the floor were on heparin drips? Which ones were, you know, you get such a cool variety of experiences just because you're smart. That's not even like the best word for it. You're competent and you're motivated and you're driven. I wasn't your average secretary. I don't think I was fun. I was super fun. And if I went to any other units, you really have to make the experience yours. I felt like I was an awesome unit secretary. I felt like I made the floor fun. Even though sometimes the floor was just heavy, you kept your spirits up and you kept your new friends' spirits up. And by new friends, I mean 90% of my friends are nurses. And you gain a new appreciation for what the other people in the hospital do. You see a lot of the times that the nurses and the clinical technicians, the respiratory therapists, the physical therapists, occupational therapists, oh my gosh, so many things. They were the ones who were really running the show. The nutritionists, the environmental services. You get to interact with all of these people and you get to deal with the doctors too. And by deal, I mean sometimes it took a really long time for them to sign their prescriptions so we could discharge a patient. And these are things you just learn in the environment of, you know, being in the hospital. At least this hospital. So yes, competence and a high drive and motivation and a goal will be an awesome way for you to experience a hospital position. The best way to go about finding hospital positions, go to the hospital website, go to their career section. They have sections that are entry level that are, I forgot what they're called, but they're basically nursing support. That's kind of the main entryway into doing clinical positions. And just look at what their requirements are. If you're confused about what their requirements are, or if you think you could bypass them based on, you know, whatever other skills you may have, call the HR department. You have to reach out to these people just to figure out, you know, is it worth it to put the application in? Just put the application in, even if you don't think you'll get it. There's nothing wrong. You're not paying for these applications. It's not like a medical school application where each one is $38 after, you know, your first one. It's not like that. So you can, and make sure you have a good resume. Don't have a sloppy resume. Get your resume checked over. Even if it's entry level, it's still a professional position, and you definitely want to put your best foot forward. You want people to take you seriously. Just because it's a hospital job doesn't mean no one's watching you. You know what I mean? It's not like that. You really have to be your own advocate, be your own best supporter. Basically, be awesome even before you step foot into there. You need to have a sense of professionalism, and you need to learn how to become a people person very quickly. You could do registration. That's fun. If you like that. I wasn't really into that, but I know they're in and out of the emergency department all the time because people are getting registered all the time. That's another thing. And you know, sometimes I feel bad for saying it, but, well, no, you have to watch out what positions you pick, because you might be obligated to stay in that position for a fairly long time depending on what the contract says. Now, I know personally our hospital changed it from being able to transfer out of a position after 6 months. And then they changed it to a year. And a lot of people were upset with that because a lot of the times you might have just gotten into the position just to get your foot in. And because hospitals have such high turnover rates, they kind of try to lock you in. So just make sure you do read the fine print just to protect yourself And make sure that the people you're working with are on the same page as you and they understand that where you're coming from, because you want to get the most out of it. If they understand you're a competent pre-medical student who's motivated to learn, they will teach you a lot. I can't even think, like the nurses I worked with, I feel like I learned so much about medicine from them that I don't even, like, I loved working on that unit. It was crazy, it was wild, but it was a wealth of information that I didn't have from before. And now if I ever move on to another position, I'll have a concept of medicine that I never had before. I cracked up once because there was a medical student, and I think they might have been second-year medical students, and they came in to do a round on one of the patients that were on their list, and there was a sign on the door that said PCA. And they're standing outside the door and they're kind of just standing there, and I walk by and I'm like, you guys good? Are you okay? What's good? Like, why aren't you going in there? You look a little awkward. Do you need something? Are you leaving? What's going on? They're like, what's a PCA? And I'm like, what? How do you not? And that's the thing. They didn't know what a PCA was, but I saw so many of them. And for those of you who don't know what a PCA is, this is your time to Google PCA and you'll find out. But I let them know what it was, and they're like, oh, okay. And they went inside, and I was like, that's crazy. That's a very common thing to see in a hospital. For them not to know what it was, I was like, what? What do you mean? Now, if you find out who the leaders of healthcare are in your community, those are the people who might have the most opportunities. And if they don't have opportunities, keep yourself on their radar. Ask, maybe could we do like a quick lunch? Can I grab a drink with you, like a coffee or a tea? Can I sit with you and maybe ask you a little bit about the healthcare system? Be bold, be an advocate for yourself. Ask these people to notice you, because you know what, when you get a person, you have a captivated audience, use it. I mean, there's literally nothing wrong with asking. And if you're the type of person that doesn't like to do their research, you will not go far with this process unless, someone hands the opportunity to you, or, brings it to light like my friend did for me. But by being on the radar or having, the concept of, I should probably be volunteering right now, that's your first inkling. I didn't have that inkling. I didn't know I was supposed to be volunteering and, being a part of my community. That wasn't something that I ever knew. I didn't have a pre-medical advisor. I didn't have a person in the medical field in my family who knew what the process was. I wasn't the researcher, and it really threw me off. So be the researcher for your own life. If you can find out what your ex did 47 weeks ago and to his trip to Aruba, I think you can find out a good research and volunteer position. Research and volunteer position. I'm sure there's research positions that are volunteer, because I really think so. Anyway, if you guys have any other, if you guys have any other questions, feel free to comment below and let me know if this kind of answered a couple of the questions. I feel like I went on a tangent, but sometimes I feel like anecdotal help or information is sometimes helpful just to get the juices going, like the brain just sometimes needs a little bit of a story. Yeah, so if you guys like this video, please like, comment, subscribe, and share it to your friends. Keep the wealth going. I'm trying to expand and, figure out other things I want to talk about. I have a pretty good list of things I want to talk about. But for the meantime, do what you gotta do. Follow me on the Instagram at Operation Surgeon. Bye, you guys. Thanks for watching.